Hello everyone. In this part, we will talk about case studies and examples, ethical consideration in providing online psychological services. Part 7, case studies and examples. In this chapter, we will explore how the methodology for executing psychological typical actions online can be applied in real-world situations. We will also discuss case studies and examples to illustrate the benefits of the methodology. Case study 1. Sarah, a college student struggling with anxiety. Sarah is a college student who has been struggling with anxiety for several months. She has difficulty leaving her dorm room and has been having panic attacks when she is in public spaces. Sarah was referred to a mental health professional who specializes in online therapy. The therapist conducted an initial assessment and developed a treatment plan that involved cognitive behavioral therapy, CBT. Sarah and the therapist met once a week for 15-minute sessions using a video conferencing platform. The therapist provided Sarah with homework assignments and tools to help her manage her anxiety symptoms, such as deep breathing and relaxation exercises. After 6 weeks of therapy, Sarah reported a significant reduction in her anxiety symptoms and an improvement in her overall quality of life. This case study illustrates how the methodology for executing psychological typical actions online can be used to provide effective and accessible mental health services to clients who are struggling with anxiety. Case study 2. John, a business executive struggling with depression. John is a business executive who has been struggling with depression for several months. He has difficulty focusing on his work and has been feeling unmotivated and tired. John was referred to a mental health professional who specializes in online therapy. The therapist conducted an initial assessment and developed a treatment plan that involved behavioral activation therapy, BAT. John and the therapist met twice a week for 50-minute sessions using an instant messaging platform. The therapist provided John with homework assignments and tools to help him manage his depression symptoms, such as exercise and social activities. After 8 weeks of therapy, John reported a significant reduction in his depression symptoms and an improvement in his overall quality of life. This case study illustrates how the methodology for executing psychological typical actions online can be used to provide effective and accessible mental health services to clients who are struggling with depression. Case study 3. Maria, a single mother struggling with PTSD. Maria is a single mother who has been struggling with post-traumatic stress disorder, PTSD, for several years. She has difficulty sleeping and has been having flashbacks to traumatic events from her past. Maria has referred to a mental health professional who specializes in online therapy. The therapist conducted an initial assessment and developed a treatment plan that involved eye movement desensitization and reprocessing, EMDR. Maria and the therapist met once a week for 60-minute sessions using a video conferencing platform. The therapist provided Maria with tools and techniques to help her manage her PTSD symptoms, such as breathing exercises and guided imagery. After 12 weeks of therapy, Maria reported a significant reduction in her PTSD symptoms and an improvement in her overall quality of life. This case study illustrates how the methodology for executing psychological typical actions online can be used to provide effective and accessible mental health services to clients who are struggling with PTSD. Benefits of the methodology. The case studies above illustrate the benefits of the methodology for executing psychological typical actions online. These benefits include accessibility. The methodology allows clients to access mental health services from anywhere at any time. This is particularly beneficial for clients who live in rural or remote areas or who have difficulty leaving their homes due to physical or mental health issues. Effectiveness. The methodology is based on evidence-based practices that have been shown to be effective in treating specific mental health issues. This helps to ensure that services are effective and provide the desired outcomes. Flexibility. The methodology allows for flexibility in scheduling and service delivery. Clients can schedule sessions at times that are convenient for them and can choose from a variety of service delivery options. Part 8. Ethical considerations in providing online psychological services. The provision of online psychological services has brought about many ethical considerations that must be taken into account. As the demand for remote services increases, it is important to address these considerations and ensure that ethical standards are maintained. In this chapter, we will explain the ethical implications of providing services at a distance and discuss the importance of ethical considerations in the context of online psychological services. The ethical implications of providing services at a distance, providing psychological services at a distance, possess unique ethical challenges. One of the main challenges is ensuring confidentiality and privacy. When conducting sessions online, it is important to ensure that the client's privacy is protected. This includes ensuring that the video conferencing platform is secure, that the therapist's computer is secure, and that the client is in a private location. Another ethical consideration is informed consent. Clients must be fully informed of the risks and benefits of receiving online psychological services. They must also be informed of the limitations of these services, such as the lack of nonverbal communication and the inability to assess physical cues. The important ethical consideration in the context of online psychological services, maintaining ethical standards, is critical in the context of online psychological services. Ethical standards serve as a guideline for practitioners and help to ensure that they provide services that are safe, effective, and professional. One of the most important ethical considerations in the context of online psychological services is competence. Therapists must be competent in the use of technology and must have the necessary training and experience to provide services at a distance. They must also be aware of the limitations and risks associated with providing services online. Another ethical consideration is boundaries. Therapists must establish and maintain appropriate boundaries with their clients just as they would in face-to-face therapy. They must also be aware of the potential for blurred boundaries in the context of online services, such as the use of social media or email. Confidentiality and privacy are also critical ethical considerations in the context of online psychological services. Therapists must ensure that they are using secure video conferencing platforms and that they have implemented appropriate security measures to protect their clients' information. Other ethical considerations include informed consent, cultural competence, and duty to warn. It is important that therapists are aware of these considerations and that they are following best practices to ensure that they are providing services that are safe, effective, and ethical. Conclusion: providing psychological services at a distance is an exciting and rapidly growing field. However, it is important to remember that ethical considerations must be taken into account to ensure that services are safe, effective, and professional. This chapter has highlighted some of the main ethical considerations in the context of online psychological services, including confidentiality and privacy, competence, boundaries, and informed consent. It is important that the therapists are aware of these considerations and that they are following best practices to ensure that they are providing services that are ethical and effective.